So maybe let me make a short introduction to today's speaker in the webinar. First of all, I think I should introduce myself. I am Professor Wilson Wong from the Data Science and Policy Studies program in CUHK. I'm going to be the host and the moderator of today's webinar. And the speaker in our webinar today is Professor Kyu-Kong Ko, a faculty member from the Graduate School of Public Policy in Seoul National University. He's a very outstanding, distinguished scholar in public administration, and we also know each other quite well. We actually just recently co-authored a book, Comparative Public Administration, which is a handbook by Edward Elgar. So Professor Kyu-Kong Ko is a top expert in terms of comparative public administration and also data science and its application in public policy. Actually, he just published a book, I think, which is also will serve as a major source of his presentation today. He has a new book called Managing the COVID-19 Pandemic in South Korea. And data science and also big data or AI are becoming more important in today's public policy, especially in combating the pandemic. Although the COVID-19 pandemic is over, but we all know that the pandemic in one form or another will come back soon. It's just a life cycle of the pandemic, so we better be prepared and learn from our lessons. And in that regard, South Korea is actually quite successful in applying data to combat the pandemic. And we are so lucky today to have Professor Kyu-Kong Ko to share his experience in managing the COVID-19 in South Korea. He actually did a very active role in advising the government doing it. So today we are so fortunate to have him to share his real-world experience of how to apply data science, critical information, and translate it in policy responses. So without further ado, I will let Professor Kyu-Kong Ko to speak for about 45 to 50 minutes, and then we will open up the floor for questions and discussion. So Kyu-Kong, it is yours, the stage.
Okay, thank you very much, Wilson. As Wilson mentioned, Wilson and I have been old friends for a long time and worked together for research, and also we share lots of the ideas about the data science application to the public administration and public policy. As Wilson introduced, I'm a professor at the Graduate School of Public Policy Administration in the Seoul National University. And today I want to share some ideas and the actual cases, how we utilize the data for policy making. And here the data is pretty much different from the traditional approach. I want to show that how the API application programming interface is useful for collecting the data, and how we integrate these API techniques to the data analytics. And also I want to show this data analytics can provide many implications to policy makings. And my case is the COVID-19. As you know, the COVID-19 was one of the historical event that we never experienced before. And this impact is huge. And lots of people realize the importance of this pandemic. However, we start to forget the importance of this event. So I want to recall what we have learned from the COVID-19 responses of South Korea. And this lesson drawing is done through the data analytics. I recently published this book, The Managing the COVID-19 Pandemic in South Korea. So that I want to also include some interesting ideas behind this book. Okay, when we start to learn the data analytics, machine learning, or the AIs, we have some kinds of different thought. The first, many people are very eager to use this AI or the machine learning techniques. So they usually emphasize act first and think later. We have no clear idea what machine learning is. We have no idea about the artificial intelligence, but we are enforced to use those techniques for policy analysis or for the research. This act first and think later was I think, the dominant trend in the 21st century academic communities. However, there is also the warning toward this approach. Before leaping, we have to think. So think before it is the pretty much very cautious approach toward these new techniques. Then which side would be the good? This is very challenging questions, but definitely we have to admit that the new techniques are very useful, but this technique should be used with very serious level of the care. So there are a couple of the issues when we want to apply this machine learning or AI or the data analytics in policy making. The first is whether we can produce the good data. Many people assume that there are huge amount of the data available in the internet or other databases. However, we have to ask this question very seriously because we cannot usually produce good quality of the data. Even if we have the good data, second question is accessibility. The lots of the data is produced by the private sector and the public sector as well. However, many public sector data is not accessible to the people, and private sector, especially many companies, do not want to share the data. So despite the existence of the high quality of data, the accessibility is a different question. Third, even though we have high quality of data and those data are accessible, we still need to ask this question: do we have a good analysis model? Well, this is a big question because we may think that we have lots of the available machine learning models, statistical model, econometrics model. However, it is very difficult to judge the usefulness of this model. So the many data analytics experts suffer from finding the good appropriate analysis model. And even if we do very good, wonderful data analysis, we still need to ask this question, whether this evidence is strong for the policy design. Our audience, the many students or the researchers realize this problem. For example, let's assume that we have our analytical model produce the predictions like, okay, the event will happen with a probability of the 60%. Then is this 60% enough to accept the policy or not? 60% is pretty high in some areas, but pretty low in other areas. In policymaking area, the probability 60%, 70%, 80% would not be strong enough to accept the policy. So we have to provide very strong evidence to accept the policy or to design the policy. So the strength of the evidence is also a very challenging question. Even though we provide the yes answer to this question, we still have the other questions. Does policy achieve intended outcomes? Prediction is just one thing, and actual outcome is the other. Even though our model provides very good prediction, but we have no idea whether this predict is actually come true in real world. So check it out, this all long path of the decision trees. Can we satisfy all these questions? Well, maybe not. This is the reason that there are very different perspectives toward the data analytics. Some are very skeptical, others are very optimistic. So we have to check it out whether the optimistic or skeptical approaches are really the methods in real world issues. Okay, today I want to start from these questions. Is COVID-19 lethal? Pretty straightforward question, but many people actually fail to answer these questions. Many people believe that the COVID-19 is very lethal disease. However, if we check it out, the trend of the case fatality rate of the COVID-19, we can find very different the views. At the early stage of the COVID-19, which started in the early the January of 2020, and the case fatality rate is very high. So in case of European Union, this case fatality rate is over almost 10%, which is very lethal disease. However, this case fatality rate changed over time. And also this case fatality rate different across the countries. What does this mean? Unlike our perception, this case fatality rate can change. It is relative concept. Without the data, if we just focus on the early stage of the COVID-19, we have some kinds of the myths that the COVID-19 is very serious disease. However, this disease would not be serious anymore as time goes on. So we needed to update our information about this, the lethality of the COVID-19 using the data. Second, when we utilize the data, we have the big problem about the detail and also the trend. These are the two different kinds of the visualization result. The left side of the graph is the daily confirmed infection cases. So this is the daily confirmed cases of the South Korea. And as you see, there are many fluctuations over days and over the months. However, right side of the trend just to show the moving average trend. If we look at the moving average trend, we can see the different patterns. So moving average and the detail or the daily change are different. And sometimes it is useful to use the moving average approach to minimize the variance. And the third thing is the data quality issues. When we collect the data to analyze the COVID-19 problem, we use the three major sources. The first major sources was offered by the Johns Hopkins University, JHU. And another was offered by the Our World in Data of the University of Oxford. And also the European Union of the CDC, the Disease Control Commissions, also they offer the data. WHO also offer the data of the fatality rate and the confirmed cases. There are multiple sources of the data, and each country also collect the data on the confirmed cases or the fatality rate. However, this data is not always reliable when buried. For example, this is the Turkey cases. If you look at the Turkey's trend of the new cases, new confirmed cases, you can see the spike at the end of the December of the 2020. Just one day, within one day, you can find more than 800,000 cases are reported. How can it be possible that more than 800,000 cases are reported in a day? is impossible. The reason that Turkey has this large number of infection cases on this day was the Turkey include all the missing cases in the same day. The missing cases was because of the different standard of the definition of the confirmed cases. When the WHO announced the principle, the standard, the WHO clarified that the confirmed cases should be based on the virus test. If we have the test kit, and if the test kit show the detect the virus, then this can be counted as the confirmed cases. However, the Turkish they add one more standard, which is the symptom. Even if there is the detection of the virus, if the symptom is not serious, they do not consider it as the confirmed cases. And so the WHO advised Turkey to include all the cases which has the positive test. So the Turkey include those cases on this day. So that's the reason that this kind of large number is appeared in the JHU, Johns Hopkins University data. However, the same country and the same data, however, the different the organization collect this data. This data is offered by our world in data of the University of Oxford. And in case of Oxford data, you can see pretty much different patterns. But this difference is because of they minimize the impact of this this extraordinary date. So the two organizations, JHU and Oxford University, two organizations report the same country's data. However, the results are different. This means that the data quality is very challenging issues. We have to choose the appropriate database, but it is very difficult to judge the quality of data across different organizations. JHU is also a very famous organization. Oxford University is also a very reliable organization. And we have to compare these two organizations' data and find out what are the extreme value and what are the data not acceptable or not logical. We have to evaluate the quality and adjust this kinds of problem when we analyze the data. And also the European, the CDC and the JHU data is very different because of the collection time and the time zone. The JHU is located in the United States and the ECD is located in the European countries. So their time zones are different. So this time zone differences also affect the number of the infection cases of each state. So this is the new confirmed cases of 3 different sources, WHO, JHU, ECDC, and you can find that these 3 sources show the different numbers of the newly confirmed cases. And this is not the end of the stories. We also find out the problem in not only the developing countries, but also developed countries. For example, the ECDC and the JHU provide the confirmed cases of South Korea, and these are the JHU cases, and these are the ECDC cases, and this the red bar show the differences. And you can find that there is some significant differences between 2 sources of data on the Korea's confirmed cases. And the worst things, which is not well reported to the people, the worst thing is this database is also change and modify and correct their errors over time. This means that, okay, the JH realized that there is serious problem of the Turkey data on the December 13 of the 2000s. If the JHU realized this problem, then JHU has to modify their database or to update their database. And this update information is not well publicized. However, the researchers should download the data when they are accessible. So they just use the data as given. But here is the two cases. The first case is the data, the download in the July 2022. And the right side is the data downloaded in the February 2024. Those data comes from our worlding data of the University of Oxford. And I did the same analysis using the two different data, and I also covered only the data between the March 2020 and the mid-March March of the 2020. So the same period, same databases, but download point time is different. And as you see, this case fatality rate of two data shows very different patterns. Why this happens? The reason is our older data, the shift is data policy from the daily to weekly. So in the left side, this shows the daily patterns of the case fatality rate. But if you download the same data on the 2024, you only get the weekly data. So if we do not have all the data over the time, it is very difficult to replicate the same result. Can you understand? So this is another serious challenges. Over the COVID-19, so many academic researchers publicize their papers. They use the data at the given time. Some researchers download the data in the early 2020. Others researchers download the data on the 2022, and others may download data in the 2024. Even if they use the same model, same the unit of analysis, and the same the sources of the data, their result would be different. It is very difficult to replicate the data analysis result because of the changing of the policy, data collection policy of the countries. So data consistency is another issue. So this is the typical problem that we have. So how can we minimize this problem? So let's move on to the techniques of the data analytics. Okay, I think our audience may be familiar with this software, not the software, kinds of the platform. You must be familiar with this Google Drive. And within the Google Drive, we can add many apps to extend its function. And this is the CoLab, co-laboratory. This CoLab is the Google Colab is the platform for integrating Markdown, which is the text the word process and also the organizing the text. And also the Google Colab allow to use the Python, R, SARS, and nowadays it also enable us to use the Stata. So within this Google Colab, we can integrate different software or statistical analysis program. So if we are able to use the Google Colab as a platform for our data analysis, we can get lots of advantage. First advantage is we can use lots of the API techniques for collecting the data. Let me show the example of this. I'm sorry, this is written in Korean, but I wrote the two books. One is the Korean book, and the other is the English book. But I use my the same data platform for writing my books. And let me show the example first. First, this SAS ODA algorithm. I use the Python and the SARS for my data analytics. So I want to integrate SARS program into the Google Colab, and these are the code for that integration. So I just put my ID, and I just put my password. Then I can make my Colab access to the SaaS online demand for academics. So the SaaS cloud system is now integrated. If I click on this code, I can execute this code if I push on this the buttons. So then, after integration of the SaaS into the Google Colab, I also can integrate the website. This is the website of the Ministry of Health of the South Korean government. And the Ministry of Health offer the data on the COVID-19, availability of the vaccine, availability of the hospital bed, and so forth. So this is the website providing those the tables. And if I access to this website and read the HTML website code, then I can also find out the tables inside the website. And this website table can be called the first table, second table, third table. I can specify the table number, then I can get this kinds of the table data. This code is written in Python. So the Python code, using the simple Python code, I can access to the government official website, and the website data is downloadable into the Colab. And also, I can access on the our working data of University of Oxford. And I don't need to access that website every day. If I just open the Google Colab, then I can use this simple code which integrate the home website homepage into the Colab. So if I click on this buttons, then I can access to our working data website, and I can get the recent data. Now the recent data is the 2000, let's say the February 4 of the 2024, and this data can be accessible. And so the website is integrated into this Google Colab. So using these techniques, I access the JHU, Oxford, WHO, and ECDC data every day. And this data is integrated using the this data is integrated into the integrated into the one data set. So we publicize all the three major organizations COVID-19 data every day and share them with others. So that doesn't take a long time. It just takes just a couple of the days, just a couple of the minutes. So at most around the 10 to 20 minutes, we can collect all the data around the world and offer that data and publicize onto the website. Anyway, so we can get all the data set, and then using this data, we analyze all the data and get these kinds of the result. And as you see, the data, for example, okay, this is also very interesting things. This is the source code to analyze the data. And I have the two approaches. One is directly collect the data from the website. And the other approach is I save the large data set onto the Google Cloud. And the Google Cloud data is imported into the SARS. So in this code, I use the Google Cloud data and analyze it using the SARS. And this approach is necessary because as I show, I compare the 2020 I find out that the original data has changed over time because of the change of the database policies. So I occasionally save the data into the cloud and using the data for our analysis. And this is all the table of contents of my analysis, and these are used for writing my books. So my research is updated using all the data code or the analysis code, and when the new data is released, then all the results are automatically updated. So I can offer the most recent data analysis result to people. So this is how we use our data analytics and API for our research. Okay, so here through this, the data accessibility is, I think, very easy and very high when we have appropriate technology. So open API approach would be very useful for the analysis. And the JHU Oxford also provide the open API, and the researcher just need to integrate the data using the API. And second issue is the accessibility of the government data in South Korea. Okay, this is as I showed you before, every day the Korean government offered the statistic on the confirmed cases, fatality cases, and other health-related data. At the beginning stage, the government just offered these kinds of paper document. In South Korea, we use the HWP, which is the Word document, word processor, and the Microsoft Word is the market share of the Microsoft Word is less than 50%. But many Koreans use the HWP as the word processor, and the government document is not machine readable. So the government was criticized just for the data in the machine readable form. Unfortunately, the government offered this data on the website, but the website structure was not machine friendly. So over and over, the government was enforced to provide the API. But unfortunately, this API was just to provide in the mid-2021 something. And even after providing open API format of the data, the government still imposes some regulations, such as the API key requirement. This means that if you want to access to the government data, you have to register your API key, and without this API key, it is not accessible. So this kinds of the regulation significantly reduce the accessibility of the data. However, also the another problem is the format. Some people use the post method, others provide the data in the GET method, and the JSON file format, XML file format. The standardization of the API data format is pretty different across the organization. So we have to fix this kinds of problems. So the accessibility is not just because of the openness of the data, it is also related to the techniques that government use. So because of that, I decide to provide I decide to enhance the accessibility of the data. ARIC, Asia Regional Information Center, is located within the Seoul National University, and I'm the director of this Asia Regional Information Center. And at the early stage of the COVID-19, we try to integrate all the data into the single forms. So this is the document data, and we read this document and put the document data into the Google Sheet, and this Google Sheet data is exported to the source data. So these are the process we did at the beginning stages. However, later on, we use the API and integrate different sources and offer the data on the website. Here is the website that I run during the COVID-19, so that we can provide all the data set using this platform. So the ARIC database data is quickly integrate all the different data sources, and on the top of that, we add socioeconomic data. If you access on the University of Oxford data, it provides some GDP per capita or the population size or the aging structures or the number of the doctors and so forth. But in the 2021, the government, the Oxford data actually did not integrate those kinds of the social. This is very important because when we add the data, the pandemic data cannot be useful without additional data such as the population, or healthcare, or the government budget, and so forth. Socioeconomic data with the COVID-19 data is very powerful, but standalone COVID-19 data is not much useful for the research. So that's the reason we integrate both the pandemic data with the economic data. And this socioeconomic data is also provided through the website. And other important trend that we found was that sharing the data analytics model. In the United States, the many research institute tried to predict the trend of the COVID-19. And the US, the government, collect this model, prediction model, every day and compare the prediction result. And these are the national forecast of the US CDC. And the CDC result showed that the different institution or different researcher predict the different patterns. So the variation of the prediction is very large. However, despite these differences, since the United States CDC collect the prediction result as well as the model, the researcher can refer to other institutes the prediction model. They can update their research model as well. So the model sharing was the significant factors improving the quality of the predictions. So this is, I think, the one of the important lessons we have to learn. Not just sharing the prediction result, but sharing the model is the other very important for the improving the quality of the predictions. And this is the important lessons we can draw from the COVID-19 analysis. The early stage of the COVID-19, many researchers produce the papers using to try to test lots of the hypotheses. However, we can find that different data set shows the different result, and also different time the choice of the time produce a different result. Here is the one example. When we say the spreadness of the spread of the COVID-19, the mobility is very important. So the dependent variable is mobility, and the independent variable is the confirmed cases. So the more mobility, the higher confirmed cases. And we use the Korean government CDC, and if we use the data, there is we cannot reject null hypothesis. It means that there is no relationship between the mobility and the confirmed cases. However, if I use the Johns Hopkins University data, and then there is the statistically significant relationship between the mobility and the confirmed cases. So meaning is, even this the same statistical hypothesis is tested, we can get the different result according to the different choices of the databases. And also the differences in data analysis result can be found by the different regions. African countries, the analysis result is different from the oceanic countries, the analysis result. So the results are different across the places. And also this is the change of the regression coefficient. And this regression coefficient is for the senior rate, how many people are over the age of the 65. So whether the senior rate affect the confirmed cases. And this line is the p-value, the baseline. If the coefficient is below the p-value 0.05, then the coefficient is statistically significant. And we can find that if we use the data in the July of the 2020, then the result show that result will conclude that there is statistical significance, the statistically significant relationship between the senior rate and the confirmed cases. However, if we use the data on the 2021, then we can find the statistically insignificant result. Regression coefficients, the change over the time, and the statistical significance also change over the time. It means that the choice of the date is really a problem when we make a conclusion of our analysis. So this suggests the sensitivity of our analysis. That's the reason that we have to monitor the change of the significances by choosing the different time period. Okay, let me move on to the first. This utilization is the well found, the monitoring the COVID-19. This shows the trend of the COVID-19 from the 2020 to the 2022. As you see, you cannot find any kinds of the very significant patterns up to the 2022. Because of these large numbers of the infection cases in the early 2022. But I divide this kinds of the graph into the 3 different time periods. This is the 2020 the trend, and this is the 2021 period, and this is 2022 period. If we just use the 3 years, if we visualize the 3 years trend, we cannot see any kinds of fluctuation in the 2020 and the 2021. However, if we divide the data into the 3 different periods, then we can see the lots of detailed change of the confirmed cases. So this means that the overall trend and the detailed trend would be different. So the government should monitor this detailed trend if they want to make a short-term or the mid-term policy making. But if they want to make a long-term policy, then they have to extend the time period of the analysis. And predictions. Lots of the people want to predict the future. This is the prediction model, and And one of the myths is the longer data we have, the precise prediction we can make. But that is total myth. If this is the prediction using the older data from the 2022, 21 up to the 2022, and as you see, the prediction in the 2021 is not much accurate. But if I just focus on the 1 year from the 2020 to the 2021, the many fluctuation is well predicted, and the prediction error is not that large. So according to the purposes of the analysis, we have to choose the right period of the predictions. So we have to use the right time, appropriate the data period, the time period for the prediction. The longer the data does not guarantee the precise predictions. And another the utilization of data analytics is the government can make a different policy using the data analysis result. This is the punishment case. This is the trend of the violation of the quarantines. In the 2020, the government tried to quarantine the infected patients. So people should stay at home. And some people argue that some violate the quarantine policy of the government. So on the April the 5th of the 2020, the South Korean government increased the penalty level, punishment level of the quarantine violation. And people say that the decrease of the violation cases. So some people argue that the government should upgrade the punishment of the violation. However, if we look at the data trend, we can find that the decrease of the violation cases is already observed even before the upgrade of the punishment. So this means that if we have the good data analysis result, the punishment would not be a good approach. Already the citizens voluntarily follow the government policies. So because of this data analysis result, the South Korean government does not increase the punishment level much. So they respect the voluntary for the compliance of the citizens. And also the another policy is related to the school the dormitory closure policy of the university. In the 2020, the government wants to close the dormitory, and we have to look at whether the dormitory opening is really the threat to the students' health. And if we look at the fatality or the accumulated death percentage, as you see, most of the deaths is found among the old people, aged people. The young people aged between the 20 to the 29, those people just explain less than 0.1% of the total deaths in South Korea. This means that the COVID-19 would not be lethal to the university students. So because of this data analysis result, government can be a little bit flexible, opening the dormitory. And also the public opinion monitoring. The public opinion change over time, and every week or almost one time per month, the South Korean government try to monitor whether the citizens are negative or positive to the government responses of the COVID-19. And we can see there are very high level of positive responses in the only period of the COVID-19, and these positive responses decreased over time. So this can be also useful for the government to design the policy, and the government has to figure it out why citizens are dissatisfied with the government policy. And this is also the another example. In the September of the 2021, government wanted to lift up social distancing policy. However, some group of group of the doctors argue that this is not a good time to lift up social distancing policy. The reason was the vaccination level, vaccination rate is low. At that time, the vaccination rate is below the 70%. Many doctors argue that the vaccination rate should be over the 90% if we clear the social distancing policy. So the people, there was huge debate whether we reduce the strength of the social distancing policy or not. However, the good data analysis results show that this number was wrong. The reason was, when we calculate the vaccination rate, the denominator was the total population. So this number used the total population as the denominator and the number of the people who get vaccine as the numerator. However, this denominator was wrong because the South Korea at the time only allowed have the vaccine to the people whose age is over the 18. The children were not allowed having a vaccine at the time. So the denominator was too large. So if we remove the children age below the 18, then this vaccination rate was almost above the 80%. So the lifting of the social distancing policy was possible because the government realized that many people voluntarily take the vaccine. So this significantly reduced the negative impacts of the social distancing policy in South Korea. I have many examples, but I cannot explain them all. So I can offer the last example of this. This long queue was for purchasing the mask. So people want to purchase the mask in the pharmacy, but there was the shortage of the mask. So people had to wait to purchase it. And the government realized that some people purchased too many the mask. So the government tried to distribute the mask to each pharmacy, and the pharmacy just the drugstores just sell the drug, sell the mask, just one or two to each person, not sell the many masks to the same person. So the people want to know the availability of the mask, whether the store has the mask or not. They need that information. Now, how can the governments provide the information? The government decided to make some website or the application. But unfortunately, because of the bureaucratic rules, it would take almost 2 or 3 months to develop that kind of website or the application usable in our cell phone. But some of the citizens and some of the data analytics experts asked the government just sharing the information of the location of the drugstores and also the availability of the mask of the drugstore. Then these people, they just asked this information to the government, and the civic expert developed the website and also the applications available in the cell phone. They developed the application within a week. They shortened the time from 3 months to just a week. So this kinds of expert group significantly contribute to the people, minimizing the inconvenience of purchasing the mask in the early stage of the COVID-19. On and on. There are so many available cases that the people use the data analytics to respond to COVID-19. So I want to conclude my the presentation. Data analytics should be embedded in our governance. So data analytics should not be limited to the expert domains, that nowadays citizens can use the data analytics. And also this data analytics is not just the statistical method. We can integrate lots of different technologies. We can use the Google Colab for the API data collection. We can use the visualizer technique. We can use the website and so forth. We also significantly reduce the transaction cost from the data generation to the sharing. API becomes the game changers. So they significantly reduce the cost of the data sharing. And also we have to empower the civil society expert for developing innovative policies. The government did not want to share the data, but eventually government realized the power of the expert, the civil expert, to solve the social problems. So those are the some lessons that we can draw from the Korean experience. I used too much time, but I want to stop here and take a question from the floor. Thank you.
So thank you so much for QCon for giving us such a informative and inspiring presentation. So now is the time for Q&A. So we would like to invite the audience to ask questions. So who would like to be the first person to ask the first question? So Eric, I saw your hand. Yeah, you can go ahead.
Yes. Could we remove I want to see Kilkun. Right now I'm looking at a PowerPoint, but I would like to see Kilkun so I can speak to him directly.
Okay.
There we go.
Yeah.
Well, first, so three things I want to do. One is to say, Kilkun, how nice it is to see you again. It's been a little while since we were together, and I hope it won't be too long before we have a chance to get together again. Second thing I want to do is to just commend you on the presentation that you just gave. Speaking very frankly, I thought at the beginning, I was kind of impatient. I felt, it was going slowly, and I thought, well, the COVID, but the more you went on, the more interested I became. I realized you're dealing with a lot of very important issues, and in a very detailed way, and in a very sort of logical and methodical way. So I just want to compliment you on a really fine presentation based on what is quite evidently very solid research. So then the third thing is to maybe give my own poorly informed comments, but just to toss out some ill-formed ideas or reactions to your presentation, and I'll try to make it brief. One is that although your presentation is based on kind of the COVID experience, and that's clearly important, and it's where you kind of gathered your experience about this, right? As I was listening, it struck me that while that's very important, it seems to me that what you're saying and what you're, kind of the message that you're delivering is actually even more important than that. And even, I would say, much more important than that. Having to do, because if we think about the kind of the underlying kind of abstract kind of modeling issues that you're exploring, and I would put that in the context of a kind of a tug of war, a kind of balance between trying to maintain a balance between, on the one hand, which is what you're focusing on the one hand, understanding what is the reality that we're dealing with, right? So COVID is unfolding, and we need to understand what is happening. And so I think of your presentation as focused on an example, a case study of how some of these techniques, the API and other, related techniques, can be deployed to get a better sense of what's happening. And you've certainly convinced me that that's very important to do, and that there are some techniques and methodologies for addressing that are important to explore, and I applaud you on what you've done there. The other side of it is what to do, right? Yes, what is happening? We need to know what is happening. But the reason we need to know what is happening is because we need to know what to do. And so while your presentation seemed to be more on the kind of ground level up, right? What is happening? What is happening? What is happening? What is happening? And as I say, I think what you've done is wonderful. The other part that needs to be addressed, it seems to me, is to think about, what do we do, right? So, and you gave some nice examples, right? I mean, should we, what about the mandatory vaccinations, and what about, how there are all kinds of policy decisions about what do we do. But and I'd like to kind of broaden this as well. So that general dilemma that we have, right? This is, in a sense, true of any policy issue that we're dealing with in real time. That's kind of where some emergent phenomenon is demanding the attention and the response of policymakers. I think of, well, COVID is an excellent example. Any kind of pandemic or health emergency. I can also think of financial markets, right? Financial decisions, right? Where we're thinking about, transactions that are happening, and the stock market falls, or the interest rates. So all kinds of things happening in real time that might beg for some kind of policy response. Or another one is, I'm sorry to say it, military applications, right? That we've got, what is happening? What do we see happening across the border? So another one is military applications, where again, unfolding developments, we think about what's going on in Ukraine and Russia, or in the Middle East with Israel and God. These are items that are happening real time, and that must be responded to in real time. And so that dilemma is very acute. What is happening? What do we do, right? Another one is, in the context of democratic societies, we have this question of campaigns, political campaigns, right? And, there's political, around the world, there are constantly different kind of political campaigns underway. And the question is, what are people, what is of concern to people? What kind of messaging should we put out? What kind of what opportunities are there for coalition buildings? So these are just a few examples that come immediately to mind. So that's why I think that your presentation is even more important than the, particular issue that you're addressing. It seems to me that this is almost a fundamental kind of classical decision. And so your contribution kind of methodologically about thinking about how we integrate some of the databases to get better real-time sense of what is actually on the ground is very, very valuable. So, but my kind of question, and I'm sorry to go on so long, my question really has to do with the statement you made about we should embed data analysis in governance. And I do not disagree. I do agree. But I'd also like to turn that around. That, in a sense, what we need to know ultimately is what's more important than what is happening is what do we do, right? And so I'm wondering if you've had any thoughts about how the kinds of, within the context, say, of the COVID example that you used, since you're most familiar with that, how might we turn around and, in a sense, kind of identifying like threshold or critical points, right? It's kind of saying, as long as we're to the left of point X, we need to do this. But if we're to the right of point X, then we need to do something else, right? So in other words, if instead of focusing on what is happening, if instead we focus on what do we need to do, recognizing that what we need to do depends upon what is happening, do you see any opportunities for kind of inverting this problematic in a way that we maybe kind of find a threshold and we're essentially saying, are we to the left of this critical threshold or are we to the right of the critical threshold? Because if we're to the left, we need to act now and we need to do this. And I'm sorry to take so long in formulating my question, Kilko.
Okay, Eric, good to see you again through the online.
Yeah.
Oh, yes, a very wonderful question. And in fact, since you realized that point, I'm very glad because when I developed this research framework, my major approach was not just the technical side. I employ pretty much different approach called the question-driven approach. You say the knowing the reality, knowing the situation is the one thing important question, and the other important question is what to do. What should we do to fix the problem? So two are different things that we have to resolve through our result analysis. And the middle ground of these two big issue is related to the question-driven. When I developed this analysis framework, I add on the question raised by the policymaker, raised by the citizen, raised by different actors of the society. And those questions are, some of the questions are related to fact finding, whether the COVID-19 is a really serious problem, whether there is the shortage of the hospital bed, or whether the economic impacts of the COVID is really serious. So those are the kinds of questions related to the fact finding. And this question identification is very important. So I try to offer some hard evidence to answer this question. And on the other hand, also people ask the question, how we fix the problem? How can we fix the shortage of the vaccine? Or how can we increase the vaccination rate? Or how can we reduce the negative impact to the economy and so forth? And this question also requests some data analysis result. So one by one, I try to first clarify what questions are raised by different actors, and also using the data analytics, I try to provide the result to help them answer the questions. So the question is the most important things when I develop this the database. And the second thing is,
so the question is the answer.
Yes, kinds of, yes. And the another thing is the kinds of, I think, kinds of dogma that people has is, I think, very serious threat to our policy making. When we engage in the policy making stages, the lots of the actors, policymakers, have their own dogmas, their own perspective. And their perspective was not based on the solid analysis, but based on their just the common sense. So I want to make them to rethink their common sense based on the data or new analysis result. And these results are offered over the time, so I can spread the good quality of the data to alleviate the long common sense or the long miss toward the COVID-19 or the policy tools. So in that regards, I do not want to provide just the analytical result, but I want to do my analysis to respond to the question raised by the policy community. That is the primary the reason I set up the research framework. And the other the approach is evolutionary approach. Here, all the database I collect the construct was not done in a day. Every day I update a new question and update the new data and add on the different perspective. So these are the shared with the others. So also the others' opinion, advice are incorporated into this system. So through this kinds of interaction with others, I can provide the better the question and also do the little bit deeper analysis. So this interactive process was possible because I open my source this all the code of the data. I also share my the analysis result or through the website. And these are the integration of this analysis and the publishing the website are done through the easy techniques. So this evolutionary and interactive approach helped me to understand the phenomena of the COVID-19, also impact of the policy. So that's the things I can get some beneficials from my research. And the final comments to your policy the importance of the policy recommendation. This is very serious challenge to the scientists. Even though we have the good evidence, policymakers actually do not trust the evidence. For example, in the 2022, there was the spike or the significant increase of the confirmed cases, but government did not want to lift up the social distancing policy. But in the European countries, in the United States, the COVID-19 virus in the 2022 was not that serious because of the high vaccination rate. So the social distancing policy was not that much essential, effective. So the government should decide, make a policy based on other countries' experience. But unfortunately, South Korean politicians hesitate to use this evidence. So although we provide the scientific evidence, the decision, policy making is on the hand of the policymakers. So as a scientist, we have to engage more active discourses or the discussions or debate with the policymaker. But the scientific evidence does not guarantee the good policy because the decision is up to the hands of the other social actors. Yes, right. Thank you.
So, okay, we still have 7 to 8 minutes left for the webinar. So I hope other participants can also ask their questions for Professor Q Kong Kong. So any questions from the audience? Okay, go ahead.
Can you hear me?
Yes,
yes, we do.
Okay. Thank you, Professor Ko, for your very informative presentation. I do have a question related to your use of Granger causality analysis on modeling the relationship between confirmed cases and mobility. Please correct me if I was wrong, because I think the Granger causality is helpful, but also has lots of limitations because it's based on the OLS regression, so it assumes a linear relationship. And second is it's often, although it's causality, it's often challenging to conclude a real causality based on this model. And often I think the pandemic-related problems need causality conclusion, so to inform the policy decisions by the government. So I was wondering whether you considered any other types of models to help answer this relationship when analyzing this very complex time series data. Thank you.
Okay, very good questions. The grounded causality is the very old approach to detect the possibility of direction of the causal relationship. We do not heavily rely on the grounds of causality. Just we want to show the some example. This kind of simple grounds of causality can produce the different result based on the data sources and also the choice of the time. And so I totally agree that grounds of causality is not enough to detect the causal relationship. However, we also use the other models, so-called the compartment model. The compartment model is kind of similar to the difference equation model, like using the system dynamics approach. And this compartment model is trying to show there are some infected cases, infected patients, and there are some contagious the ratio, and if they interact with the people, then how many of them infected, and this will also affect the number of the patient and the number of deaths. So that this will also reduce the number of the people are in the hospital, and so forth. We can provide some kinds of the dynamic relationship using the difference equation or the agent-based modeling. And we also use that kinds of approach. But as you know, this kinds of model is very impressive in some senses. However, for the prediction, this does not produce the high quality of the prediction result. So this means that we still struggle for finding the good predictive models. And also the causal relationship is always challenging because we have no idea about the definition of the causal relationship, because since there are so many different understanding or approaches of the causalities. So we try to use the simulation approach, we try to use the econometric approaches, and also we can use the panel data analysis or the structure equation model approaches to analyze the causal relationship. However, all are not that much satisfactory. One thing clear was that, however, we want to show the what are the precondition, what are the results. That kinds of the time differences across the variable would be detected using the basic visualization or the basic techniques, the statistical techniques. For example, the more test, if there are big debates in South Korea whether the confirmed case, the number of the confirmed cases is because of the number of the tests. People say the government have the more the test, then this result in the more confirmed cases. So the confirmed cases is the result and the test is the cause. But using some data, simple data analytics, we can find out the opposite is true. The more the confirmed cases result in the more tests. And also the more confirmed cases, the result in the large number of the deaths after 2 weeks or something. So we can find this kinds of relationship among the variable using the data analytics, but we cannot provide conclusive the argument about the causality among the variables. Okay, very good questions. Thank you. Oh, okay. Machine learning. I'm not sure that machine learning is also the solutions of the predictions. Still, the machine learning also struggle with the lots of the issues. Thank you.
Okay, since we start a few minutes late, so I think we can still take one more questions. So I think we just got one question. Let me see. So that's a question from the audience from Joanna. She's from Philippines. She wants to ask a question about integrating data analytics within the government. She would like to know about the experience of South Korean about that. and how does the South Korean government do? I think the question is, how do the South Korean government do in integrating data analytics inside their policy making? So because we heard a lot from your presentation about how you advise the government of doing it. So to what extent the government itself actually building up the capacity in doing the data analytics? I think that's the best way, right? You transfer the policy learning to them, they learn it, they build it inside as the internal system. So to what extent the South Korean government is doing that? Kyung-Kwan.
Okay. Also very important issues. At the early stage of the COVID-19, government emphasized technologies. They emphasize to use the cell phone. They emphasize using the credit card information. They emphasize using the CCTV, and all these technologies are emphasized. However, these technologies produce lots of the data, but the government does not pay much attention to utilize the data. So the many experts ask the government, share the data for better analysis. And the government hesitate to share the data. So that is the big issues in South Korea. For example, after released from the quarantine, citizens suffer from lots of the psychological problems. We want to know what psychological problem people experience. So in South Korea, we have the national healthcare system, so we can collect the data of the patient after release of their quarantine. But government did not want to share the data because of the privacy issues. So the relationship between the government and the experts are not that smooth at the early stage. But over and over, the government realized that they have to persuade the citizens. To persuade the citizen, they need more the scientific evidence. So doctors or the data experts, they are asked the government. They were asked by the government to providing some scientific evidence. So every month, the public health expert do the survey under the support of the government, and also the doctors provide, and the mathematicians provide some simulation or the prediction model result to predict the trend of the confirmed cases or the death rate and so forth. So that we can strengthen the relationship between the government and the expert. But I cannot say that the South Korean government is still very open to the expert. The government still hesitate to share their information to the civic expert. So that's the one problem. Second problem is the data literacy or technology literacy of the bureaucrats is pretty serious. The many civil servant bureaucrats do not have the experience to use these kinds of the data analytics. So they have no idea about the power or the potentials of the data analytics. That makes the bureaucrats hesitate to fully utilize the data analytics for policy making. Okay.
So, thank you, Kyung-Kwan, for the responses. Actually, the problems you mentioned are also happening in many governments, including Hong Kong. So definitely your sharing, your presentation is very applicable and generalizable to people and scholars from other countries as well. And because of time, I think we have to end the webinar here. We all learned a lot from Professor Kyung-Kwan, and he actually attended our mini conference in data science and policy studies about 3 months ago. I don't remember the exact time. So we are a good fan of Kyung-Kwan, not just me, but also the faculty itself. So hopefully we can see Kyung-Kwan again, and then he can give us an update about his research in the future. But at this point, let's give him some big hands, and thank you so much. Thank him so much for such a wonderful presentation. And thank you to all of you for attending the seminar as well. So thank you so much, and we hope that we'll see all of you again very soon in the future webinars. So thank you so much for coming, and thank you so much, Kyung-Kwan, for
Okay, thank you very much. See you soon in Hong Kong
stay in
also.
touch.